My name is Dr. Albert from Kairos Medical Center. Today, we would like to welcome you to our session where we are going to talk about complications in pregnancy. We would want to focus on what we expect in early pregnancy. These are one of the complications that we expect mothers to develop during pregnancy, and it's not a must that you will have to have all these complications or any of them. Some people have a smooth pregnancy and they will even notice that they're pregnant maybe in second trimester when they're saying they have missed their periods a number of times. One, the first and most common complication of pregnancy is persistent nausea and vomiting. This is usually as a result of the hormonal changes or influx of certain hormones that we would expect to go high in pregnancy. Two, some mothers experience spotting or bleeding during pregnancy, and others end up with abortions, or where people will want to take it as a miscarriage. Abortions are quite a number of them, but the common one that would can be prevented is when you go to a facility and you're told you have a pretend abortion. That can be stopped, but if it has already happened, the best thing is usually to see that it's taken to completion. We have this category, number 3, where we have infections. Infections are quite many. There are those that are bloodborne and there are those in the urinary system, but we want to focus on those that are bloodborne. These are most of the time sexually transmitted. Others could be transmitted through other ways. Because of the details that are in it, I'll just list the most common and those that we should watch out for. We have what we call toxoplasmosis. Many people may not understand it. It's not common, but it can happen. We have other infections like syphilis. Yes, syphilis can cause a miscarriage. It can cause complications, stillbirths, early labor. We also have what we call herpes. It can be the herpes simplex that forms blisters around the mouth and the genitals. We could have the varicella zoster, that's also herpes virus, where others think of it as a CCP. It can also cause miscarriages. HIV is something that, well, may not cause a miscarriage, but can be can lead to other complications in pregnancy. We also have what we call rubella. This is one of those infections that people are vaccinated against during childhood, but because they have an implication in adulthood if somebody has them, so we must take immunization or vaccination seriously. We have hepatitis, can also cause complications in different ways that we will not talk about today. Then we also have the fourth complication that is usually iron deficiency anemia, where you have less oxygen carrying blood as a result of low iron content. In this case, it's the basis why we give mothers supplements during pregnancy to help them build and make more blood. Then we have something that we call gestational hypertension or high blood pressure during pregnancy. Well, there are two categories, but the one we are talking about today is the pressure as pressure, not with other complications. In this case, somebody could have had pressure before pregnancy and pregnancy complicates it, or could have developed high blood pressure during pregnancy, and after pregnancy the pressure goes back to normal. I would request we end here today with the complications, so that next time we shall talk about complications that we expect in late pregnancy. However, if you see any of these symptoms, please visit your medical service provider, or you could come to Kairos Medical Center in Namuongo, and we shall be able to serve you